Hello, everyone, and welcome to another episode of the Today's the Day Changemakers Podcast. I am Jody Grunwald. This week, my guest is Dr. Andrea Feigl. Andrea is the CEO and founder of Health Finance Institute. She's a former researcher at Harvard Chan School of Public Health and a former health economist with the Organization for Economic Cooperation and Development. She was a Salzburg Global Fellow, a Harvard Graduate Leadership Initiative Fellow, former president of the Harvard Club of Austria, and an internationally certified teacher in classical ballet from the Imperial Society for Teachers of Dance. Her work focuses on health systems financing and governance, universal health care, and cost effectiveness of chronic disease interventions in developing countries. Listen in to hear Andrea talk about how she manifested having a not-for-profit organization and what happened 10 days after she opened her offices. Health Finance Institute is a global health 501c3 organization focused on closing the financing gap for non-communicable diseases. Go to healthfinanceinstitute.org for more information. Please subscribe to the Today's the Day Changemakers YouTube channel. Download the podcast from most streaming sites. Don't forget to like and follow us on Facebook and Instagram at Today is the Day, Live It. Also, to learn more about Today is the Day's overall programming, International Annual Forum, the upcoming Changemakers Connective, business coaching and consulting, go to todayisthedayliveit.com. The views expressed by all Today's the Day Changemakers podcast guests are their own. Their appearance on the Today's the Day Changemakers podcast does not imply any endorsement of them or any entity that they represent. Thank you and have a fabulous week, everyone. Hello, everyone, and welcome to another episode of the Today's the Day Changemakers podcast. I am Jody Grunwald, and as I say every week, I get to interview the changemakers, the inspirers, and those who are just disrupting the status quo in their corner of the world and beyond. And today I have Andrea Feigl. Hi, Andrea. How are you?
Hi, Jody. It's very nice to be on your show, on your podcast, and I'm doing very well. Thank you.
Oh, I'm just so glad that we could do this. Heather Mistretta connected us, so I'm grateful. I'm always grateful to those who help make these connections. So thank you to Heather. And what I'm going to do, Andrea, is really quick, just read from your long and amazing bio. I'm going to condense it just a little bit, but everybody needs to know that her bio is incredible. As Health Finance Institute's CEO and founder, Andrea brings extensive leadership experience in academia, the public sector, international organizations like WHO, WB, OECD, and the global nonprofit sector. Her past work focused on the economics and policies of preventing and treating the economic burden of chronic diseases, as well as on health financing and governance, UHC, and cost effectiveness of chronic disease interventions. She's been recognized as the innovator of the evidenced formal coverage index metric for universal healthcare coverage and co-founded the Young Professionals Network for Chronic Diseases. Apart from being the recipient of multiple prestigious awards, such as several Harvard Graduate Awards and the Fulbright Scholarship, she has also authored several high-level reports, including development aid flows for chronic diseases for the Center for Global Development and a leading WEF Harvard report on the global economic burden of diseases. She's a native of Austria, has her Ph.D. in global health from Harvard University, and I can go on and on and on, Andrea. How does it feel to hear all of that?
I'm like, who is this person? So I don't look at this every day, so it's nice to be reminded sometimes to look back instead of looking forward of what one has done and not done yet. So thank you for sharing that.
No problem. I read everybody's bio and I take every word for heart because of the fact that it takes so much to get those words on the page. It sounds great once it's on there, but the work that went into it. So that's why I always like to go back a little bit with my guests and learn a little bit about little Andrea and how you got to where you are today. So let's talk a little bit about where you grew up and what were some of the things that you enjoyed as a child.
So yeah, I grew up in Austria, in a very small town in the south, close to the Slovenian border. Actually, not too far from where Arnold Schwarzenegger grew up himself. So Austria is often associated, I guess, with Mozart, Red Bull, Sound of Music, and Arnold Schwarzenegger. But what we often not associated with, because people don't know it, is we have a really great healthcare system that I've had the privilege of using and just taking for granted when I grew up. And I also had a really great public education. And so I have this interesting background where my parents were always very supportive of my education, but I come from a very sort of underprivileged background. So I'm the first university graduate in my family. My grandparents were farmers, and we didn't have a lot of means, but I always wanted to succeed and see more of the world. So there was this juxtaposition of getting a really great education, but not having a lot of financial means. And I was afforded a really great possibility, a really great opportunity. When I was 16 years old, I was offered a scholarship. There were two Austrians that were selected in the entire country, and I was one of them. And I was allowed to study in Norway for the last 2 years of my high school at a school called the United World College. And this, a United World College, at that time, there were about 10 schools worldwide. And the particular school in Norway brought together 200 students from 83 different countries to finalize their 2 last years of high school education and learn how to basically live together, work together, understand each other, with the notion that how can people build peace at the global level if they don't even know how to live together or who these people are. So it was a very transformative time in my life where it wasn't just about the academics, but it was also about how can you become a change maker in the world. And so that was kind of to me, and I just had my 20-year reunion. I don't feel that old, but I am that old. I just had my 20-year reunion. And I always said it was the best and the worst time in my life because it really transformed me, because it opened my eyes to so many different issues, but it also um, taught me that I come from a lot of privilege having grown up in Austria, but it also taught me that there's always different views and different ways of seeing the world, and that need to be taken into account if one wants to create a global consensus around issues. And after that, I was always a person who loved science and who loved arts. So I got a scholarship to study in Canada, where I was allowed to basically double major in biochemistry and dance. I was like, well, if I want to dance, I need to do it when I'm like young. And so I double majored in biochemistry and dance. With biochemistry, the notion of I loved science. I was always very good at science, and dancing was my passion. Um, and then, I built my CV and eventually found public health as my passion. But um, yeah, I hope that answers your question, but feel free to ask more.
Oh yeah, I've got so much floating around in my brain right now. I actually want to go back to the fact that your family were farmers, right? So and the reason I'm going back to that for a second is that there are people listening to this, right, who want to
Mhm.
be on this track, right? They want to go to
Right.
Harvard, or they want to become a CEO, and they think about the fact that their family didn't afford them or give them all of the things that they wish they did. How are they going to get there? I don't have the knowledge. I don't know. I don't have the know-how. What advice do you have for those? You had it internally yourself to push through, even when things might not have seemed familiar. Do you have any advice you'd give to someone out there who's just feeling like, "Well, I don't come from that. So how do I
Right.
find it?"
Yeah, I think so. First of all, I think what you're doing, basically providing the world with role models that people can get to know about and can get to understand a little bit better, I think is one part of the story, or one part of what needs to be out there. And just to clarify, so my grandparents, were farmers, and but my parents, they were teachers, but we came from a very modest. I came from a very modest background. So, and my parents had very little understanding, like, about the college admission process in Canada and North America. I asked them whether I should apply to Oxford or Columbia University, and my mom was like, well, just you decide. You're a smart person, and I think it's a very different dynamic when you look here in the States, what's going on with the college admission process. So I always looked at I chose my own role models. I was like, who are the people that I can look up to, that are doing great things that I would like to do. So I loved reading biographies. I loved reading biographies about those who discovered the HIV virus, those who discovered how to transplant a human heart. And I was really inspired by these stories, or who were the valedictorians 2 years ahead of me? What do they do? What they do in their extracurricular? And so I always looked at, I never looked at, oh, I have such a poor background, I cannot do. I always looked at positive examples, and I wanted to be excited about a positive example rather than be held back by my limitations. So I think, and that outlook I think has served me well, and sometimes perhaps even better than I would have imagined. But I think, yeah, I think just looking at who is in your life that could potentially, in what she or he does, expand your own horizons in a way that you want it to. And that's kind of what I was looking for.
No, that's a great advice. I totally am with you on that. When we first spoke, we had a lot in common about the ways we see things. And I'm the same as you. I'm always looking for who's smarter than me, who's gotten further ahead than me, who can be my mentor, because mentorship never ends, no matter how old you are. It's very important to have mentors, I think, at every stage of your life. We talked also about, and I loved what you said. I actually had written it down when we had our initial conversation about manifesting a nonprofit. And I thought to myself, what a great way to put it. You had said that in our initial conversation. So I'd love for you to share a little bit more about your organization. And I know it started right before COVID, right? I mean, it literally was on the heels of it. And so, if you can give us a little bit backstory on that, and we'll move into more of what you do and the incredible work that you're implementing.
Yeah, thank you so much. And I love that question, Jody. The organization that I founded and that I lead is called the Health Finance Institute. We are a 501(c)(3). We're based in Washington, D.C. And, I first was exposed to the policy world in 2007 in Washington, D.C. when I was an intern there. And I got to go to a great many deals of like luncheons and policy discussions. What I loved about like the think tank and the network and the environment was that there were so many ideas on how to make the world a better place. And I wanted to one day lead an institution that was part of that fabric of how can we, through intellect, through evidence, through discussion, through presenting the results of these discussions and research to policymakers and influencers, make the world a better place. And so when I was in a process of, mapping my life, I like making work, life plans. I was saying, well, in the next 5 years, when I get my PhD, and 5 years later, I would like to have a nonprofit or think tank in Washington, D.C. And the funny part of that story is I didn't say for how long precisely. So we started the Health Finance Institute early 2019. We were very privileged to receive a large startup grant in early 2020, and we opened our office end of February 2020. And 10 days later, we closed that physical office space. And we've opened it and closed it many times since then. But I always thought to myself, well, for my next manifestations, I need to be more specific. I would like to open a think tank that remains open and does well financially over the next 5 years or so. So I just thought it was really funny that I manifested it, but I only manifested that small part and none of the details. So I'm now a big proponent of detailed manifestations.
100%. I'm just going to stop you right there, because there's something that I've recently been kind of put in place with, which is something called the 369 manifestation. I don't know if you're familiar with that, real quick. And it's you write down what in the morning, you write down the same thing that you want to manifest 3 times. In the afternoon, you write it 6, and before you go to bed, you write it 9. And exactly what you said about, I'm all into manifestation as well. I've seen it work firsthand. And when you write it, it needs to have a lot of those details as a part of it, because like you said, you leave one little thing out, like stay open and look at what happens. Just incredible. But for those listening, definitely take a look into manifesting the things that you want in your life. It's real, it works, and it happens. So go ahead. I am sorry.
No, that's I love that. I love that. I mean, I just thought for a moment you were suggesting I could have manifested the pandemic away, but
No, the door is being open. Just the doors being open longer.
Just the doors being open, exactly. Yeah, and so what we do, what the Health Finance Institute does is it's really resting on a mission that we know how to make the world healthier and we know how to make the world wealthier. And these two things actually go together very, very well. So prior to starting the nonprofit, I was involved in a lot of studies that had big headline findings, like if we prevented chronic diseases like diabetes, cancer, heart disease, lung disease, mental health conditions, we could save the developing world $47 trillion in economic losses over a certain period of time. We would help India grow their GDP by 5% a year more. And just to put that into context, that's the same amount that like a recession costs, right? So I felt that we were just producing these studies and there was no political leader, no global organization listening to these studies and picking them up and saying, gee, we have to do something about it. We have to start preventing diseases. We have to use that evidence so that we can actually grow our economies and most importantly ensure a healthy life for the citizens of our nations. And that didn't happen. And I was involved in 3 UN high-level meetings. So each year, the United Nations General Assembly has specific focus areas. And in 2011, 2014, and 2018, the focus of one of the days was on chronic diseases, how to prevent them, how to act together, what should be the global targets, and so on. And similar meetings like that in the HIV/AIDS space resulted in massive financial commitments, both at the national as well as at the international level, to the order of billions of dollars annually spent and committed. For chronic diseases, that didn't happen. So we have development assistance for health, which is basically poor countries receiving money from rich countries, as well as from donors. And they get about $30 billion a year in health care related funding, but they receive less than 2% for chronic diseases. Or chronic diseases make up more than 50% of the deaths and more than 60% of the burden. So there's a huge lopsidedness around the sizes of these issues and the money that is being spent. And that wouldn't be such a bad thing if countries in and of themselves would say, okay, we can pick up the tab. But that's not the case either, because some countries just don't have enough resources to offer the full universal healthcare packages, or they're still just building the technical capacities. But many of them are not spending the suggested at least 5% of the national healthcare budget. So you can debate, should it be the country? Should it be the donors? Should it be the rich nations? But at the end of the day, it's people who suffer, right? At the end of the day, it's that person with diabetes in South Africa that says, I wish I had HIV/AIDS, because if I had HIV/AIDS, I could get treatment. But if I have diabetes, I have to be alone at home and suffer. And I'm like, this is such an inequality that I care so deeply about. And as part of the Sustainable Development Goals, there are these new goals that say the private sector should be involved, we should have partnerships, and about 20% of the funding should come from the private sector. But there's no organization that said, how should we do that? And I thought, well, first of all, we have to be able to collaborate. And second of all, we need to translate the evidence into investable products. And that's basically what our company does. We basically say, here is how much money you can get in return or in savings if you form a public-private partnership, or if you invest in this particular intervention, in this particular access, in this particular treatment area, so as to ensure that we're not just sitting on these studies and they're on the scholarly websites, but they're actually getting translated and partnerships are being formed. So that's really the core mission. We, through evidence, can accelerate investments in health that harness something called the double bottom line. And the double bottom line is basically saying we get health returns, but also we get financial returns.
Incredible. Wow. I mean, I'm just sitting here in awe. That's incredible that you put this concept and all of this program together on your own.
I had a lot of help. So I had a mentor in 2018, I was still at the OECD, and I was already putting my first, I had this is a personal story. I was going through like a burnout and sort of like a crisis of, well, what am I going to do with my life? What is my calling? Um, and I was like, I have to start this organization. It was like, I have to do this. There's nothing, I have to do this. And I was very lucky to have a mentor who was a senior fellow at Harvard at that time, and I still had an affiliation with the Harvard Medical School at the time as well, or Harvard School of Public Health, and through a program there, we were able to recruit for research assistants, and one of them then became my co-founder. So in late 2018, we wrote a couple of concept papers, working papers that we published, and it became more and more clear to me I wanted to really work in health finance and innovative finance. And in the first year in 2019, and we had very little money. So I'm talking like very little money. You can look up our 990s, but we basically were like, very cash poor. However, we were very human resource rich. So people, when we put up the website, which at the beginning, somebody volunteered for, somebody designed our logo for free because they resonated with the mission. We had about 17 volunteers of amazing caliber that started to believe in that mission. So it was like a gift, I never thought that this mission resonated, but I soon realized, this mission is bigger than me and a co-founder, or this mission is bigger just, about me, what I want to do with my life. It is really about, accelerating progress on a social issue that affects millions globally, and a lot of people want to make a difference. And so I think the Health Finance Institute was extremely fortunate that it had a lot of a lot of human capital to help create this organization and bring it to the success that it has today. I think, as a founder and a leader, I think I have been sort of the one constant in that, among many supporters, among many staff, and so on. But it is like the organization is the result of a lot of brilliant and extremely social impact oriented individuals, many of which are lifelong friends.
Yeah, I want to go back to something you said before, because I'm a CEO and co-founder of a nonprofit also. And it's what we talked, another thing we had in common is there's that burnout time. You said that a little bit ago about that burnout time, trying to figure out what you wanted to do, right? What was going to resonate with you and drive you in this next phase of your life. And so a lot of people that get into that space, they hear them, they know that that's what they're hearing in their mind, but they're not sure where to go and what to do. And certain people work to figure that out. And what you did was you decided to say, okay, this is a concept. Who's going to jump on board with me, right? Who wants to join me? And you were surprised, as I was. Wow, people actually care about this, right? I'm not crazy. This is important. People actually like what I'm sharing, what I'm saying. But because you have the guts, and just putting it plainly, the guts and the motivation, it changes people's lives. And you don't realize the impact of just having that little bit of fire and motivation, and how it in the end can save people's lives in certain ways, mentally, physically, emotionally. So, kudos to you for seeing that, but also sharing that, because it helps to give others permission that they can do it too. And I think that's often the issue, is when people get stuck in their life and they don't feel fulfilled, it's because they're not sure of the how.
Yeah. No, I agree with you. And, I think I had to give myself permission to really explore who am I, as opposed to what does society want me to be. I think that we're given a lot of guidance, in the first 25, 30 years of our lives, right? Well, do well in high school, do well in university, get a good first job, be a good employee. But what if you're called to something different? What if your your calling is something that isn't a regular 9 to 5 job, or things like that? And I think there was this disconnect about all the things and all the experiences that I brought to the positions that I held versus what I was allowed to bring to that particular position. And I think that was really actually what, when you constantly try to offer more, but that what you are is actually not appreciated, I think that dissonance or the disconnect can be mentally more difficult than just working hard all the time if it's for the right reasons. And I don't want to, but that's not to say that you should not also have a balance, even if you love what you do. Like, that is absolutely critical. And I can talk to that about that a little bit more as well. But for me, it was really about, okay, so I've checked all the boxes of a good student, self-sustaining, I'm mom of a very amazing young boy. And then it really became about, but who am I? Right? Now that I've checked all these boxes, who am I and what am I going to do with all those boxes that I've checked, right? Like, what is it? And I remember I was sitting at my French psychologist's office, and he had given me this book to read by Alan Watts. It's called On the Taboo of Knowing Who You Are, or Who We Are. And I was just looking at it, at that title, on his leather couch. And here it was, it's like, Andrea, start this organization. It was literally like, Andrea, start this organization. And I'm like, I didn't agree with everything in the book particularly, or I'm a fan, but I'm not a fan of everything by Alan Watts. But it was that little title that's like, know who you are, and then, authentically relate to that person, and don't put that person in a little box every day you go to a job in the morning. So, and by letting that out, a lot of things just cleared up. Like, I was still exhausted, and, I had to basically make sure I create balance in my life, but I knew I was doing the right thing and for the right reasons. And I think that in and of itself is extremely liberating.
We're going to get back to that balance. Yeah, go ahead. Keep going.
Yeah. And then in terms of the organization, I think that it's the same, going back to what we talked about earlier about examples of, where you come from and where you would like to go. So I had experience in both, European as well as North American workplace cultures, European bosses, North American bosses, and so on. And I really wanted to bring sort of to attempt to have a more ideal workplace. There's never an ideal workplace, but attempt to create a workplace that plays to the strengths and to the people that are showing up, and not to the job description. So we, for example, have flexible working hours in a sense that, yes, we have some standing meetings and everybody's got to show up to these, but as long as everyone delivers and is transparent, so we ask for transparency, but then we give flexibility, right? Like, if you're a night owl, you can work at night. If you're a morning person, you can work in the morning, as long as we're ensure that the quality is good and the deadlines are being met. And that attracts a certain type of personality. Usually people are very proactive who work with us. So maybe there's a bit of a selection bias, but I think that in terms of that balance that we all need as people who show up to a particular set of work today, I think I think we've done pretty well as an organization. And the other thing I'm really proud of is that, so we had this team meeting the other day, and it was in person, so I was in our office space, which was nice, and it was about 10 of us. I had to step away a couple times for some, board calls, things like that. And every time I came back, there was this laughter emanating from the meeting room. People were joyful and laughing as they were doing their work. And I'm like, dude, you gotta kick us out, we're so loud, And I'm like, well, if they kick us out for laughing, it's okay. But I took a moment, I was just listening, and I'm like, wow, if people can be that joyful showing up for working at the Health Finance Institute, we're doing something right here, because you can't laugh like that and be inauthentic, right? Or you can't laugh like that as a group if you hate your coworkers. Right. So, and I said to myself, well, if we have no impact in the world, at least we have happy employees. So
well, I really do think you have both, for sure, without a doubt. Ham10 is a leader in IT enterprise solutions and staffing. They are driven to transform their clients' business performances. They do this every day by providing their clients with the best services and products. Products like BizLego, an online community platform, and Colear, a unique learning management system. They also transform the lives of women and children through their associated nonprofits, SheTech, which supports women in and joining the technology field, and Softkin, support organization for kids in need. PAM10, technology for social good. Go to pam10.com for more information. Where do you see hope? Where do you hope, I should say, Health Finance Institute is going to be in 5 years or 3 years? So, what is your goal?
I think one of the goals is really proving this investment thesis through actionable projects that investing in health can actually yield specific returns. So we have a couple of pilot projects where we did the modeling and say, well, every time you invest $1 in this diabetes project in Armenia, you get $7 back in return. And we want to actually take it a step further and prove that with either national projects or other projects globally. We're going to embark on a partnership with another organization who is rolling out an impact strategy and access strategy in 40 different countries. And in 5 years from now, we will hopefully have the metrics to show that the investments being made in these 40 countries actually positively correlate both with the health as well as the bottom line of the projects and investors that are involved. So I really hope that, when we talk again in 5 years from now, that we can show that show these increased investments, but also increased returns in health, as well as by the investments being made in these 40 countries.
That's incredible. And your passion is just right. You can feel it through the Zoom screen here, and you're doing such great work. And I'll always remember you talking about the laughter. Like it's just such a great feeling. You've got the impact and where you're trying to do finance and health together. And then on the other hand, you're creating great relationships within your organization. So you're leading by example as well, because health is let's face it, you and I both know burnout leads to chronic illness, right? It does lead to chronic illness. So that's definitely an issue. Going back to balance, how do you stay balanced? Because as a founder, and I'll raise my hand, as I have a nonprofit and a for-profit, as a founder, how do you find the time? And you have a small child. So tell everybody the winning combination.
There are many days where I don't feel that I'm winning. So, but I mean, there is sort of, there's many small and medium-sized sort of guidelines that I could share that all form sort of a larger part of why, like, how one can find balance. So so there's a couple things that I do, and I'm not being paid for them, but I use the Calm app every day. So I use the Calm app, and every day after my son goes to school, I take a 10 to 15 minute walk with the Daily J, which is just a short meditation. And I can tell you, the days that I don't do this meditation in the morning, I'm a different person. So like, it just really makes a difference. I'm very lucky. I have an extremely amazing, organized executive assistant, Mariah. A big shout out to her. And she makes sure that A, I show up to my meetings on time, but B, that, my schedule is also clear during times when she knows that, I need to recharge, for example, as well. And I think that at the beginning, that was definitely a struggle. There were 2 times. So the first year of the Health Finance Institute, I was just like, go, 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 go. I had like 14-hour days. Don't necessarily recommend them, but it was kind of like, I have to do this or else. I kind of imposed that on myself. And then during the pandemic, in the first year when all the gyms were closed and we had a lot of moms with 2 and 3-year-olds that all of a sudden didn't have daycare anymore. And I tried to like absorb a lot of extra workload. I think these were the 2 hardest years. And I think that by coming close to my physical limitations, I had to reset again and say no. And I had a wonderful coach who told me, there is a space around you. Visualize a space around you, Andrea. And there is around that space is a semi-permeable boundary. And inside, it's what's only you. And you deserve it. And it's not your institute, it's not you being a mom, it's not you being a wife or a partner or this or that. It's just you. And if it gets too small, you need to make sure you have enough space in there. And you can only let the good things in, and you can decide what God comes in. And anything else that's negative, it's reflecting it. It doesn't permeate it. And that visualization, that's my like go-to. If the going gets tough, I just imagine like, okay, what's in it? And whatever is tough, is it allowed to come in? And so I don't know if that answers your question about balance or not. I try to exercise, I try to eat healthy. I try to turn off my computer at 10:30 p.m., which is really hard. I'm a night owl. Do I succeed every day? Absolutely not. Did I freak out before my yoga retreat this year of like my company is gonna fail if I go on this retreat for 7 days? Absolutely yes. Did I come back more recharged? Also absolutely yes. So it's really like it's a journey and again it's not winning. It's just trying to aim for that balanced north and giving yourself grace on a daily basis.
That is such a good point. Giving yourself grace. And I always give Fred Wozniak from the Food Bank of South Jersey. He says being in the present is a present, right? So being aware, being present in the present is a present. That's it. I always get it mixed up because it's present 3 times. And so the thing about that is I know for myself, I spent many years worrying about the future. Like you said, if I go away for 7 days, when I come back, is this place still going to be standing? If I don't work 15 hours a day, then this whole thing is going to fall apart. And so when you speak, I feel like I'm hearing myself because it's incredible. It's exactly the same words, but also it is that time, that grace and the manifestation of knowing and believing that things will work itself out. This podcast wouldn't have started if I didn't all of a sudden just say we need to have positive people like yourself sharing their story. The other thing is that it is so vitally important, as you were talking about before, about the fact that you have to give yourself the time to deflect the things that are negative. And I love that so much, putting yourself in that space where things are bouncing off of what you've surrounded yourself with. I'm going to see that in my mind's eye now. So I thank you for that.
Yeah, you're welcome. And actually my son loves it too. He was bullied a lot last year and he had a really tough time. And particularly with one other boy. And I said, look, like, this is your time to grow up right now because, your mom has the same issues at work. Like, I don't have bullies right now, but I have difficult conversations. I have individuals that, I have a difficult relationship with. And how do I manage? And this is the tool that I use. And so every time, like, he thinks about a difficult time now, or he actually draws that kind of picture himself as well. So it's actually quite powerful to sometimes have images help you get through and navigate situations. And yeah, I mean, and the other thing I wanted to add to your comment about starting on your mission and your listening to your calling and starting, among other amazing things, this podcast, is that it's it is also important to inspire others and also hold them accountable towards their responsibility of making this world a better place. And I don't mean this from like a negative, demanding way, but in a way that relieves you and I from that burden during the 14th and 15th hour of the day. Like, we're superhuman sometimes, but we're just 1 or 2 individuals, right? And we can only carry so much. And we need to acknowledge that we are also allowed to rest. We are allowed to recharge. We are allowed to, engage in, dinners with our friends. And I think we forget that sometimes because we think we have to do it all. But I think what the pandemic has taught me is that we cannot do it all alone. We all have to, if we want to all, beat that virus, we all have to do something about it. And that may have been wearing a mask or taking the shot, or that may have been doing that amazing mRNA research, or, debating this with friends. But it wasn't up to one or two individuals. It was really up to society to make a dent in real big societal issues. And the role of role models is a big societal issue, right? And the role of global public health is a big societal issue where I'm hoping to make a big impact. But at the end of the day, my organization and my mission relies on the goodwill and support of so many others as well.
Well, you're definitely on your way. It sounds like you're connected to the right people. You've got people cheering you on. You've had volunteers from the beginning. So that is always so validating when you haven't even started yet and people are, on the board with you and cheering you on and ready to go. So that's truly amazing that you were able to do that. But I can see, you have that spirit, right? So it takes a certain spirit to get people to understand why things are important. And even if you don't have all the answers, but you have the passion, for whatever reason, that becomes magnetizing.
Yeah.
So
I say it's 80% grit, 10% passion, and 10% craziness. So
I know I got the last two. Passion and craziness, definitely have those two. But the other thing that is very important, and it goes with my last question, right? Because you're talking about how it can't just be you and me. There has to be lots of other people involved in this. And the important thing is a lot of people don't think that they have the ability to leave a footprint behind, because a footprint doesn't have, how big is our feet, right? It could be, I'm a size 6.5 shoe. So it's a pretty small footprint. But the thing about it is that it doesn't matter whether it's small or it's large, as long as you're doing something. We're taking up space here every single day, oxygen. So what are we giving back, right? Because we have this great opportunity to meet incredible humans and do incredible work. So my last question to all of my guests is, what is the footprint you're creating right now that you want to leave behind?
The footprint that I'm creating right now that I want to leave behind, Joe, this is a really tough last question. I just have to tell you that. The mission that we had with the Health Finance Institute was basically to raise $1 billion and to save 50,000 lives in 5 years of our existence. And we are still on that journey there. We are in year 3. We're still fighting the good fights. And I think that, if we can reach even 200 or $300 million extra raised for chronic diseases, and it costs approximately $50,000 to save a life within a health system, I think then, I think that would be a really wonderful accomplishment for us if we can really save that many lives or be part of saving that many lives. Right now, in the short run, we are working with a wonderful congresswoman in Mexico. She's a person living with type 1 diabetes, and her constituents don't have access to medical devices in order to manage their blood glucose. So it's a lot of children and youth that really don't know where their insulin or their devices are coming from the next day. And we were able to support them in opening a center, and they're now treating already 75 children as of this month. And with them wanting to scale it to 500 in the first year and then more over the years to come. And we were able to negotiate the prices of the devices down for them, which, was actually instrumental in creating greater access. So these are like the stories that really, not the stories, it's an accomplishment that has brought to life why we exist, and that creates so much meaning for us. And even as I'm saying this, I don't want to take credit for it, because I think that it was 99.9% our partners who did it, but we were allowed to be part of this really amazing story. And Jody, I wanted to say one more thing, if that's okay. When you said, how can you matter? And I came across this amazing resource recently, again, through networking, through serendipity. And it's a book by Jordan Kasaloff, and it's called Dare to Matter. And he contends with this question: Like, what impact do you want to create in this world? And he encourages his readers to write down a mission statement about what is it that you would like to do with your life, but be authentic and create sort of a spectrum between impact and money, and then decide how important is money or personal wealth versus, nonprofit work, which isn't as lucrative for you. But then how do you want to then give back? And that can be that you give back by being engrossed in a nonprofit space, or that through your wealth and connections, you can make a different type of impact. And both approaches are valid. Both approaches have to represent who you are, but he offers this kind of framework that allows for different people from different walks of life to discover their own way to matter. And I just wanted to throw that in there because I think it's helped me so much. So I hope it can help anyone who listens to this as well.
Sounds like it's going to help me. I'm going to be, it looks like I'm going to be buying that book. I'd love to have him on the podcast. That sounds incredible. Thank you for sharing that, Andrea. That's awesome. That's a great book. And our footprint too doesn't always have to be connected to our work. We're very much work conscious because we want to make a difference in the world, but our impact can be, I told the woman at Starbucks the other day that she's a change maker, and she cried. I said, you make people smile and laugh, and they're excited about what they're coming in to drink, and they're doing it every day, and you know their name and you know their order. You are helping them to feel like they matter. And she looked at me and she started to cry, and I'm like, that's how easy it is to help create a footprint in the world. So every piece of what we do matters. It's just if you want to take, how you take it to heart. That's the way I personally see the world. I don't know if you see it differently.
I see it exactly like that. I think, everything matters. I like your words matter, the way you carry yourself, the way you interact. It doesn't mean like you have to always be perfect, but you can at least try to be kind and work on yourself, as I'm sure you do. But I try to be a better version of myself every single day. And it's really incremental changes, right? It's incremental changes in attitude, and it's incremental changes in how we relate to others. And that's exactly it. I think if everyone had a positive demeanor and a positive attitude, then the world would already be a better place.
Yeah, agreed. Totally agreed. Our job would be done. We'd all just be living together in one, feeling great all the time. No negativity. So tell everybody how they can find more information out about the Health Finance Institute.
Yes. So we have a website, healthfinanceinstitute.org. On Twitter, we're at So we have a website, healthfinanceinstitute.org. You can find me on LinkedIn. You can also look up our Twitter. It's at healthfininst is our Twitter handle. You can write me an email, Andrea at healthfinanceinstitute.org, and just, say, hey, I've seen this. I want to know more. We also post about opportunities. So there's a wealth of information through these online resources, and I hope I've inspired at least one of the viewers or listeners here.
Absolutely. You already inspired me. So that your job is already done. Now I'm sure there's people around the world that you're going to inspire with this podcast. Andrea, thank you for your time and for sharing all of your insight. I really, really appreciate it. It's a blessing to have met you, and I look forward to getting updates on all the incredible work that you're doing. And hopefully you'll be part of our international forum as well. And so any last things that you want to say before we go?
I think the most important part is to really think about being your authentic self. My boxing instructor gifted me this sweater and said, be your authentic self. And I've been wearing it a lot this year. And what it means to me is basically that, I don't lie to myself, and in the way I work and how I work and what I do, who I really am. And I think that has really been helping me not just prioritize, but also see how I can create an impact. And it's just also grounded me a lot more. So authenticity is something that's really, really important to me.
I mean, I love that. We have so much synergies because I constantly am saying, leave your A game of armor behind and bring your A game of authenticity to everything that you do. And life is just be much easier. So Andrea, thank you again. I really do appreciate your time. And I'm going to say what I say at the end of every single podcast. Today is the day. You cannot go back to yesterday, and you do not yet own tomorrow. So what steps, small or large, are you going to take today to get yourself closer to your goals? Andrea Feigl, thank you so much for your insight, and we look forward to seeing all the many more things that you're going to be doing. Have a great week, everyone.